Welcome back. Vaccine hesitancy remains a challenge for health officials, even with a new highly contagious COVID variant. Our next guest says there are significant barriers in some communities. For more on that, we bring in Dr. Ezemenari Obasi from the University of Houston. He joins me live. Good morning.
Good morning, Sally. Thanks for having me.
Well, thanks for being here on Christmas Eve with us. Not only are there a lot of vaccine myths out there, you say, but do you think there are a lot of misconceptions as well about who is vaccinated and who's not? Because it's not just a certain group of people who is vaccine hesitant, right?
Absolutely. And I think when we go back to vaccine hesitancy, that has happened well before COVID-19. And then when you think about how some of this has been really politicized, folks are having a hard time even being transparent about their vaccine status.
So the Kaiser Family Foundation just put out a poll. It says almost 90% of the unvaccinated say the Omicron variant won't persuade them to get the shot. What are some of the barriers that are leading to vaccine hesitancy, particularly in underserved communities where your research has taken place?
Yeah, I think people just really have questions that they want addressed, and they don't want to be dismissed. They don't want to be shamed or blamed for why they have questions. But, why was this done so quickly? What technology is involved in these vaccines? What's the long-term consequences of being vaccinated? Why do we need so many shots and boosters? I mean, just basic questions to where if people take the time and have empathy and patience and sort of really bring data to these questions, I think people will be moved over the line to actually be okay taking the vaccine.
So what is being planned for next year to address this? I mean, what do you think people need to hear?
So for us, I think we're going to have a lot of one-on-one conversations going door to door, having town halls where we could actually answer questions and even create sort of short videos that debunk some of the misconceptions and disinformation that's currently circulating on social media.
And so is your ultimate goal, doctor, to really empower people? And what do you hope, they get out of these meetings with you one-on-one?
We definitely want to empower people, or we want to give them a range of options to choose from. And so even if you're hesitant to take the vaccine, what are some steps that you're going to take to protect yourself, and sort of really go over the consequences, the benefits, and answer any questions they have so that they can feel like they have options to get back to that sense of normalcy and be able to engage family and friends like they once did.
And the ultimate goal, I guess, for you too, is to keep politics, out of public health, which has been a real challenge this year.
Absolutely. That's actually one of the biggest things that comes up is, can we please remove politics from this? Can we please just focus on the public health, focus on the data, focus on how I could protect my family, how I can get back to work, how I can get my kids back in school. Like, that's where people want to focus the conversations on.
Well, Dr. Ezemenari Obasi, thank you so much for joining us from the University of Houston. Merry Christmas to you and Happy New Year.
Happy New Year's and Merry Christmas to you.